Hey guys, so we are now at part 4 of my Medicare series, Turning 65. And today we're going to be talking about Medicare Advantage, the good, the bad, the ugly. Now, you guys have been asking for Medicare Advantage videos, so here it is. We're going to go over a lot of information. So let's get started. More than half of the people in America today are on Medicare Advantage. I've saved people thousands of dollars on Medicare Advantage plans. But I've also seen people that have been surprised by the copays, and it's not as predictable because, the good and the bad thing about Medicare Advantage is you pay when you use it. The great part about this is you're going to get this with absolutely no sales pitch, because that gives you a chance to hear something that someone doesn't have an agenda for. On this channel, we talk about Medicare, senior resources. We talk about caregiving. All those things are very important to our community. I'm glad you're a part of it. So let's start with the good. As I said earlier, Medicare Advantage can have a very low or even a zero monthly premium. That can be good, especially if you're healthy and you're not seeing a lot of doctors. The other thing that's really good about Medicare Advantage is they give you some extra benefits. A lot of them will give you gym memberships. They have vision, dental, hearing. Even some of them have over-the-counter benefits where you can save money at the pharmacy. And even some have transportation, although I need to ask a lot of questions about that one. Now, the bad. I would say the bad is the networks. Because whenever I hear people talk badly about Medicare Advantage, it's almost always that their doctor doesn't take their plan. And that's why I say ask a lot of questions, and why I put my checklist in my book, Everything Medicare, How to Silence the Medicare Noise. I have an 18-point checklist that goes step by step, all the questions you have to ask. So you will never go back and say, my doctor wasn't in network, because you'll know exactly which doctor. Just same with the medicines. We want to make sure that all of the prescriptions you take are on the formulary. That's one thing about having a Medicare Advantage, is that typically they are HMOs or PPOs. And we talked about that last week. HMOs, you have to stay in the network. PPOs, you can go outside the network, but you have to pay more. So for your best savings, you have to stay in the network as well. Another bad thing is prior authorizations. Nobody likes this part, but sometimes if they are going to pay, they want you to have prior authorization before a procedure. That goes soundly into the bad column. The other thing is travel. I even have people that they spend some time in one state and other time in another state. The problem with that in Medicare Advantage is your home state, you are covered to see all your doctors that are in network. But when you leave to go to the other state, you just have emergency and urgent care coverage. That's going to go in the bad. Here's the ugly. Serious illness, long-term treatments, cancer, heart attacks, strokes, that can really start adding up as far as your copays. That can get ugly. So who should consider a Medicare Advantage? Number one, somebody who's asked a bunch of questions. Then you know you're safe to get on a Medicare Advantage. People who are healthy. If you don't have a family history that has a lot of diabetes and heart conditions, Medicare Advantage may be a good choice for you. So I would say people that have done their homework and people that are healthy. Now, who should not consider a Medicare Advantage plans? I would say someone who travels a lot, someone who has a family history of a lot of chronic conditions. I would be careful. and think about that. Really consider if a Medicare Advantage is right for you if you have that family history. And also the travel. The travel's a big thing. If you travel a lot throughout the US and you would rather, if you're traveling, to be able to go to a hospital to see a doctor, a specialist, to get whatever treatments you need, then you may not want a Medicare Advantage plan. All in all, Medicare Advantage plans can be good. I know I put my dad on a Medicare Advantage plan probably when he was in his 70s because his Medicare supplement had got so expensive. And he lived to be 93 years old and was always on a Medicare Advantage plan. And it worked really well for him. He didn't go to the doctor a whole lot, maybe once a month, but those copays didn't really add up too much. It didn't create a problem for him. So it was a good fit for him. But there again, I helped him with that. And we did a lot of homework. We did a lot of research on his doctors, his formulary to make sure we had a plan that was going to fit his needs. And we did it every year. Very important because plans can change. And really this, I think, should go into the bad or the ugly is that every year plans can change. That means doctors can leave, formularies can change, copays can go up. So every year you have to check on this. And that's what we did for my dad. Every year I would go over what's called an ANOC, the annual notice of change, and see what changes were coming. I have included a free guide for you guys. It's 10 Medicare mistakes that can cost seniors thousands of dollars. And I want you to avoid every single one of them. Like and subscribe. Tell your friends about it as we build this community. And as far as your free guide, there's a description below where you can go and get your own free guide. Be sure and do that. It's totally free. Thank you.